February is American Heart Month, and here on DMG TV2's Medical Minutes, we'll talk with Canton cardiologist Dr. Firas Hamdan, also cardiac surgeon Dr. Tony Chrysos on how to keep your heart healthy, and we welcome in North Canton dentist Dr. John Scott. We'll be talking about National Children's Dental Health Month and how to keep your kids brushing, all coming up here on DMG TV2's Medical Minutes. Hello, welcome back to DMG TV2 Medical Minutes. I'm Jennifer Clark, and on our first segment today, we have Dr. Firas Hamdan, and he's a cardiologist from Canton. Welcome to the show.
Nice to have you.
Now, when we say cardiologist, it's because this month we are focusing on heart health. It is American Heart Month, so we want you to take care of your heart. Before you go see Dr. Hamdan, our cardiologist, tell us a little bit about your practice. What do you do?
I'm a cardiologist. I'm based in Canton, Ohio. We practice mainly at Mercy Medical Center. I'm part of Cardiology One, which is a group of 8 physicians, and we manage all aspects of cardiology.
So from the early stages to someone who is very, very sick.
Exactly. And we have different specialties that we handle. We have mainly preventive cardiology. We have general cardiology. We have specialized cardiology like intervention, balloon intervention, stents and placements, as well as electrophysiology, which is the electrical heart function devices, pacemaker implants, and of the sort.
And one of your special areas is congestive heart failure, right?
Congestive heart failure occupies nowadays more and more a large part of our practice. It's growing. It is the leading cause of hospitalization in the country and worldwide nowadays. And just like in our nation, we see it becoming more and more important in our practice.
Now, when we say congestive heart failure, that's different from a heart attack. This is not your heart stopping. What is congestive heart failure?
Congestive heart failure is an abnormal function of the heart muscle, being too weak, unable to pump enough blood forward, retaining fluids, causing symptoms like shortness of breath, decreased activity, even pressure in the chest.
So it feels like a heart attack.
It feels like a heart attack in such a way that it causes the pressure, but it is not. A heart attack is a direct damage to the heart muscle that is caused usually by an occlusion of an artery and blood flow lacking to the heart muscle, thereby causing injury to the muscle itself. Once that injury happens and the heart function deteriorates, congestive heart failure settles in. So in a way, congestive heart failure is a result, partly in times, from a heart attack.
So what do you do for that? How do you treat that?
Treatments of heart failure are multifaceted. We have obviously preventative treatments, which we like, first of all, most of all, prevent heart attacks from happening. So we go over the increased activity, we go through all the prevention algorithm, watch out for your risk factors, minimize your cholesterol, increase your activity, decrease your blood pressure, control your blood pressure.
All easier said than done.
Much
diet
easier
and
said than
exercise, everybody says, oh, watch your diet, exercise more. People still don't do it.
Unfortunately not, and we end up on the tail end of it, having a heart attack, undergoing damage to the heart muscle, developing heart failure, that we end up managing chronically on a long-term basis in our hospitals and our clinics.
And can you do that with medication?
We do. Medications is a large portion of, or a large part of medical therapy for heart failure. It mainly includes giving treatments like diuretic, drugs that will eliminate that blood flow or volume retention. It also involves giving certain types of medication to improve the heart function, to unload it, if I may say so, and to help it prevent it from recurring. It works. Medications have been a mainstay of medical treatment of heart failure for years and will remain so. But over the years and over time, we have found that there are also alternative ways of helping heart function. And one of those has recently become the implantation of pacemakers.
That's the electrophysiology part, right?
That's where the electrophysiology intervenes and enters the realm of heart failure. Certain people with heart failure and weakness in the heart muscle who have a certain propensity of or a certain conduction abnormality, electrical malfunction, if I may say so, as well as weakness in the heart muscle, may benefit from pacing the heart in such a manner to improve its contraction and improving the forward flow of blood out of the heart.
So it pumps the heart for him.
It does. It helps the heart be resynchronized, both left heart chamber as well as right heart chamber, and improve the blood flow and improve the patient's symptoms. It has been shown also to decrease mortality, to make people live longer.
That's the whole point.
That's the whole point. We are unfortunately measured by our increased survival rate.
So how many people are eligible for a pacemaker?
It's not, it's a minority of patients who are eligible and who do receive it. Unfortunately, the greatest majority of patients are treated the right way, but still with medical therapy.
And you mentioned earlier about watching your risk factors. What are some of those risk factors?
The main risk factors for heart disease as well as heart failure are the same, have not been changed. There are high cholesterol, hypertension, obesity, sedentary activity, lack of exercise. We also have diabetes mellitus. The biggest one, though, however, is cigarette smoking.
And still, there's so many programs out there on awareness to please quit smoking because of all kinds of disease, including heart disease. And are those programs working?
They are, to a certain extent. And that's why, Heart Disease Month, which is in February this year, is so important to reemphasize the preventative measures that we can do before we develop heart attacks and end up in heart failure.
And anything else that you can pass along to our audience to make sure that they don't become one of your patients?
Keep checking yourself. Make sure you visit your family doctor. Make sure you control your risk factors as much as you can. There is help. Talk to your family doctor, your primary care physician, and they can hopefully help you out.
All right, very good. Dr. Firas Hamdan, he is a cardiologist from Canton. On this segment of the DMG TV2 Medical Minutes. And stay tuned, more to come. Welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and this time around we have Dr. Tony Chrysos. He is a cardiac surgeon from Canton. Welcome to Medical Minutes.
It's great to be here.
And since it's February, Heart Month, we're focusing in on heart health. Being a cardiac surgeon, by the time you see patients, is it too late for them to fix whatever is wrong with them?
Not at all. Coronary artery bypass is the most commonly performed operation in the United States today. And for good reason, our outcomes are good, and we give patients a second chance for a normal, healthy lifestyle, provided that they take care of themselves afterwards.
And when you see patients, do you always do a bypass?
Not always. Sometimes we'll have patients see us because they want a second opinion, or because they just want a surgical standpoint, a surgical view of what's going on with their health. But by and large, most of the patients that we see are patients that are specifically referred to us because they do require heart surgery.
And how long have you been in Canton doing this?
I've been in Canton since 1990.
And you've seen probably thousands of patients.
I've operated in the last 25 years in over 6,000 patients.
And what is the most common thing that you see among those patients?
By and large, it's coronary artery disease.
Which is that cholesterol plaque buildup inside your arteries, right?
That's correct. Cholesterol buildup inside the coronary arteries cause various degrees of blockage in the coronary arteries. And patients may either present with chest pain and the usual symptoms, or with no symptoms whatsoever.
That's the scary part you're talking about.
Or with a massive heart attack. So there's a gamut of things they could present with.
And what are some of the risk factors involved? Is it always a family history? Well, if my dad had a heart attack, so am I better get some help.
Family history is, I believe, the biggest risk factor. In addition, major risk factors include diabetes, smoking, high cholesterol, high blood pressure. Those things off the top of my head are by far the most common causes of coronary artery disease. And then there are other risk factors that are less frequent, less common.
And do you have control of that? Can you change your diet, exercise, and change your lifestyle and take control of your blood pressure and all those other factors?
Yes, it's actually extremely important that you modify your risk factors, if not eliminate them. There are some publications that now have shown that lowering your cholesterol alone, in addition with smoking cigarette,
But not smoking, right?
by not smoking cigarettes and losing some weight and exercising, that virtually after coronary bypass, you can live a normal, fully active life without the risk of a heart attack going forward.
And what's involved with bypass surgery? You take a vein from somewhere else and have a detour around the blockage, right?
That, in a nutshell, is what we do. Generally, we use arteries and veins to bypass blocked arteries. The blood supply that we use generally comes from the aorta, or if we use an artery, it comes from its own blood supply, from the artery's blood supply. The average number of coronary bypasses that we do per patient is 4 to 5.
Really?
Yes.
That seems like a lot. But
That's the average.
and once you have the bypass, like you said, you still need to maintain that healthy lifestyle because the bypass, they can block up pretty quickly.
That's correct. If you continue to live the life that you lived before, and if you do not quit smoking, and if you do not curb your cholesterol, then your risk of having the bypasses themselves become blocked is extremely high.
And when you see your patients and you tell them this and explain it all to them, do they take your advice?
By and large, my patients do. Nobody wants to have heart surgery again. And that it's a great motivating factor. I have patients who smoked before their operation and had to spend an added amount of time on the breathing machine. And they're the ones that especially don't want to go through it again. And I haven't met too many people that don't really want to quit smoking. It's just very difficult. But once you give someone the incentive that they need, it's much easier, and it's much more convincing argument for quitting smoking.
And we've been talking about the patient themselves. What about their family and their coworkers around them? Should they also, obviously they should follow your advice as well, but is it more difficult when the guy next to you is not quitting?
Well, I explain to families that if the person who has had bypass surgery is trying to quit smoking, it should be a family thing. They should modify their risk factors altogether as a family, because if they have children, their children are at risk for coronary artery disease because it is hereditary. So changing our eating habits is a good start. Eliminating the ashtrays from the house is also a great start. Plus, if people need to continue to smoke, they should smoke outside the house, away from someone who is trying to quit smoking, because it is extremely important that they do quit.
And there are many awareness campaigns. Do you think that those are helping people change their lifestyles? Healthier eating, more exercise, quitting smoking. There's so many different programs to help you along. There are almost too many, and you never know who to listen to.
I do believe that actually our patients are much more well educated to the symptoms of heart disease, especially of heart attacks. They now recognize that if they start having chest pain, if they're not feeling well, if they start jaw pain, that it's time to see the doctor.
And what are some ways that, besides the symptoms, are there ways to diagnose heart problems or coronary artery disease?
Stress test.
And what's involved with
A
that?
stress test basically entails a patient that would walk on a treadmill, and while they're being monitored by a physician, a cardiologist, to see if there are any changes in the cardiographic monitor. If there are no cardiographic changes, electrocardiographic changes on the monitor, that doesn't mean that it's negative, because then they use a radioactive isotope at a delayed time and obtain images which would designate areas of the heart that aren't getting enough blood. So a stress test does work. If its stress test is negative, it does not mean that you do not have heart disease either. But it's a great first start, and it's a great first diagnostic tool.
And always, if you have any questions, go see your doctor and ask them.
Especially if you have a history of heart disease in your family, and especially if you smoked for many years.
All right, very good. February is American Heart Month. Our guest on this segment has been Dr. Tony Chrysos. He's a cardiac surgeon in Canton. Thanks for the advice.
It's been my pleasure.
Hello, welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and on this segment, we have a dental surgeon, really, general dentist, Dr. John Scott from North Canton. Welcome.
Thank you very much.
So tell us a little bit about yourself and your practice. What do you do every day?
I'm a general dentist from North Canton, Ohio. I do family dentistry from age birth until late 90s is my oldest patient. I treat a wide variety of oral disease.
Is it always surgery, or
No, it is not
just
always.
a regular checkup we can come in and see?
Yes, general dentistry is your everyday dentistry. Most people go to the dentist every 6 months to have their exams and cleanings. But in dentistry as well, there's other aspects. There's, of course, people have heard of root canals, they've heard of dentures, they've heard of crowns and bridges. But a special aspect that I have in my practice is the surgical aspect of dentistry, both with children and with the special need population.
So you've seen the gamut of what goes on in your mouth.
Yes, I have, and it is a gamut.
Well, February is National Children's Dental Health Month. So I want to focus a little bit on kids. Do you see, do kids brush their teeth? They don't want to. No kid wants to brush their teeth. Why not?
No children want to brush their teeth. Simply, it takes the extra 2 minutes away from their Nintendo DS or their cartoons on TV or their bedtime stories.
So how do you get them to brush?
Mom and dad must brush the teeth. A simple rule in dentistry is all parents until the age of 6 must brush their children's teeth. Starting at about the age of 4 or 5 is when we would like children to begin brushing their own teeth. I prefer that the children brush their teeth after mom and dad have brushed their teeth.
So they watch.
No, mom and dad do a good job. Children are learning the basic concepts of brushing their teeth. It's pretty amazing. There have been several studies done. Children are awesome toothbrushers. They do a very good job on the same 2 or 3 teeth. They tend to brush the same teeth over and over again. Whereas when mom or dad brush the teeth and do a thorough job, that's what helps prevent the spread of disease that we see in the oral cavity today.
Now, what's the best toothbrush to have? Should you use the manual toothbrush? Should you get the motorized toothbrush? You go and to buy a toothbrush, I'm overwhelmed. What's the best brush?
If it has a handle and it has bristles and toothpaste can go on it, it will work.
Well, how do you choose?
Whatever works. For children, I tell all my families that I serve, let your child pick out the toothbrush. If it lights up, if it plays music, if it spins, the Sonicare type children's toothbrushes, whatever the child is interested in using, they are more likely to use. So it really does not matter. The most important thing is, I tell all the children, Dr. Scott's rule of 2s. We must brush our teeth twice a day, and each time we brush them 2 minutes each time.
So twice a day,
2 minutes each time.
So do you have a timer?
Most
Flip those over.
Most children's toothbrushes today that are what I would call the deluxe or the children-friendly models that light up or play music, they're all built in with a timer. And
They never had that when I was a kid.
no, we had a basic toothbrush, but they actually have a 1-minute timer. I'm kind of going back on what I said. It's the rule of 2s. It is the rule of twos for adults and for everybody. We'd like to see it 30 seconds per quadrant in the oral cavity. However, with a child, if I get 1 minute of continuous brushing, they've done an excellent job.
And more than 2 teeth.
And more than 2 teeth.
Now, what about flossing? How do you get kids to floss?
There is really no need for children to floss.
They
Young-
like that.
Very young children, they have spaces in between their teeth that allows for the dentition to develop and erupt into their mouth. So the reason adults floss is our spaces are very tight, and it allows us to get the plaque and tartar out of those spaces. But with the children having the spaces in their teeth until they get the adult dentition, there is really no need to floss.
What about fluoride? Some communities have fluoride in their water, others do not, and so the dentist will give children a fluoride treatment. Is that important?
It is very important. There are 2 types of fluoride treatments. The kind that you are referring to that the dentist applies is called the topical application of fluoride. It basically coats the teeth and protects all the little nooks and crannies in the top of a tooth.
And you, the dentist, puts that up?
Yes, the dentist office does put that on. The other type of fluoride is called systemic fluoride. That is what several populations get through their water supply. And that actually, the fluoride ions incorporate into the bones as they're developing. Now, there's been several conflicts in the past few years of overfluoridation, underfluoridation, and actually the American Dental Association, in conjunction, I believe, with the American Pediatric Dental Association as well as the American Medical Association, have worked to revamp the entire system to come up with the correct amount of fluoride. And 9 times out of 10, the pediatrician will prescribe those for the child in an unfluoridated community. Some of the problems we ran into is that people with wells, fluoride ion can naturally occur in well water. So we had children that were overfluoridating because they were receiving systemic fluoride as well as natural fluoride ion from the water system at their house, which was coming from the ground.
So should you
So-
test your children and make sure that they're not having too much fluoride?
You do not need to test your children, but if you have a well, you should have your well water tested. Most local water softener supply companies, people that sell water softening systems for your home, they can actually test your water, and they have a machine that can break down exactly what minerals are in that water, and it will tell you how much fluoride is in your well water. That way you know your child is not being fluoridated.
And is there too much emphasis, or can there ever be too much awareness and education to get dental health into a child's life?
There can never be too much education for a child when it comes to dental health. I tell everybody, if you go back in time, they say that the average life of a caveman was 20 years. They needed those teeth for 20 years of their life. In today's day and age, we are asking people to live 100 years, 110 years. It would be a blessing if everybody had their own dentition until they were 100 years of age. Dentures are not a substitute for what was originally in your mouth. And the only way to guarantee that you keep your dentition throughout your life is to properly take care of it.
And start at a young age?
And start at a young age. And it truly begins at home with the parents. I tell everybody, are children allowed to have a soft drink? Of course they are. Are they allowed to eat ice cream and candy? Of course they are. You cannot take the good things in life away from a child, but moderation is the key to everything. I have 3 children, and all 3 of my children, they eat more candy than who knows what. They sneak it like every other child. You know, when we go out to dinner, it's a treat to get the root beer or a Sprite. But their teeth are brushed twice a day, and things are given in
For 2 minutes.
moderation. I wouldn't say 2
Do you
minutes.
stand over your own kids and time them?
Actually, I don't brush my children's teeth. I make my wife do it.
Oh, there you go.
I told her, when they get their first cavity, it's not going to be my fault.
Oh, great.
So I put the blame on her. But no, they, you know, if you properly take care of the teeth and you simply brush them, you monitor their sugar intake, you should be fine. One of the best products for middle-aged children, I would tell you from the age of 6 to 10, is a product called Listerine Agent Cool Blue. If you remember when we were children in school, we used to eat these pink tablets that would turn our teeth pink.
And show
Well,
where all the plaque was.
They developed a new mouthwash that you can rinse in your mouth. It turns your teeth blue. So you have your child rinse with this product, and they brush their teeth, and then they smile in the mirror, and half their teeth are still blue. And you have the ability to say, you did a very good job up here, but what about back here? So children are very visually stimulated. If they see something, they understand it. And this product really has made a difference for the children to see how to brush their teeth and
right.
properly get them clean.
Well, you've provided us with all kinds of great advice for National Children's Dental Health Month. Dr. John Scott, a general dentist from North Canton, our guest here on DMG TV2's Medical Minutes. Join us next month when we'll bring you some more tips here on DMG TV2.